In our last video, we spoke about polycystic ovarian syndrome, what it is, how it is caused, and what are its short-term effects. Today, we will talk about what the long-term effects of PCOS is, and also how to control the symptoms which come from PCOS, as well as how to make sure that it does not have significant impact on our quality of life. So, as you may remember, I did inform you that the most likely cause for PCOS seems to be insulin resistance. So basically, insulin resistance is the inability of the cells to respond to insulin in the body to pick up glucose from the blood, and so there is increase in glucose levels in the blood as well as insulin levels in the blood, and their after effects, of course. So first of all, as you may see, there is increased blood glucose levels, which is obviously the diabetes, the very well-known friend of ours. Almost most of us have somebody or the other struggling with diabetes in our family. So the first and foremost effect of insulin resistance is diabetes. Secondly, the obesity driven by insulin resistance can lead to a low-grade inflammatory status. Well, I'm now speaking medical terms, so let me simplify it. A low-grade inflammatory status is a situation where the body is acting as if it's constantly fighting an enemy. That is, it's producing all the chemicals as well as antibodies which are basically produced when we have an infection. So in the absence of infection, obesity, and in the presence of obesity, this low-grade inflammatory status happens in the body, and the chemicals released have an impact on the lining of the blood vessels, especially those supplying the heart. So obviously, this increases the risk of heart attacks in the people, as well as the risk of stroke, the risk of high blood pressure, and so basically a combination of obesity, high blood pressure, diabetes, and high fat levels in the blood, as represented by what we call lipid levels, triglycerides, LDL and HDL, together it's called metabolic syndrome, and it significantly increases our risk of heart attacks. To simply put, insulin resistance of PCOS increases your risk of heart attack, our risk of heart attack. Thirdly, you may remember that women with PCOS have irregular periods. That is, they may not have periods for months together. Actually, I have seen women with no periods for 6 months to 12 months, so on and so forth, before they actually reach the doctor. This is not good for the lining of the uterus, the endometrium, because the progesterone which is being produced constantly by the ovary, irrespective of whether the egg is released or not, continues to thicken the lining. And this has to be shed, that is, a period has to happen at least once in 2 to 3 months. If this does not happen, then that could lead to abnormalities of the endometrium. At the lowest stage, it is called hyperplasia, endometrial hyperplasia, which could be benign, or it could also turn into cancer. Now, please don't be scared, this is extremely rare. I said we need to have a period at least once in 2 to 3 months. And if you have this, then it's unlikely that PCOS would be the direct cause for endometrial cancer in any woman. So, to summarize all this, I've spoken a lot. To summarize all this, the long-term effects of insulin resistance of PCOS includes diabetes, the metabolic syndrome, which increases the risk of heart attacks, and then risk of endometrial cancer. Last but not least, there are psychological effects. Obviously, PCOS has impact on weight. So there is obesity. It can cause acne and abnormal hair growth, and all these result in body image issues. Secondly, there is a concern about fertility. Although about 60 to 70% of women conceive without much difficulty, rest may have problem and they may need treatment, and that also puts a stress on the woman herself as well as on the relationship. So these factors can lead to psychological effects such as depression, anxiety, etc. So guys, these are the long-term side effects. As you can see, there is a lot to understand. However, you may put down your comments if you have any queries regarding this, and I am happy to answer. And in the next video, I will talk about how to control the symptoms of PCOS. Hi, so we spoke about a lot of things about PCOS. Today we will talk about how to control PCOS. So when I say control PCOS, I do mean control PCOS. We cannot treat or cure PCOS. We can keep the symptoms under control and minimize the effects of this very common condition on our lifestyle. So you may remember that PCOS is driven by insulin resistance, and this is either genetically driven or it could be genetic as well as complemented by obesity. So obviously we can't change our genes. We are what we are when we are born. It's decided even before we are born. So the other thing we can deal with is obesity, as well as some medications to help reduce the insulin resistance in our blood. So basically, you may remember that there are lots of long-term side effects of PCOS, as well as it's driven by insulin resistance. So what does this tell us? The menstrual problems of PCOS, with which mostly the women present to a gynecologist, are only one of the manifestations of PCOS. It's mainly an endocrinological problem, that is something to be dealt with by a team of doctors, a endocrine specialist, a gynecologist, and a dietitian. And if there are any other effects such as high blood pressure or cardiac effects, then relevant specialists should be involved. First and foremost, reducing your weight through diet and exercise helps to significantly reverse the effects of insulin resistance. So basically, the loss of fat cells from the body increases our sensitivity to insulin, and hence the male hormone levels go down and our cycles come back to regular periods every month. So how do we control our weight? How do we reduce our weight? Of course, with the help of dietitian or any other online apps you may find. There are multitude of them. Please choose what suits you best. I'm not going to say what helps me. I do take the help of an app to help. I have taken the help of an app to reduce my weight as well as to keep it under control. So you choose what is best for you. And regular exercise, about 3 to 5 times a week, about 45 minutes a day. That is what you need in the first stage to control the PCOS and its effects. Secondly, there are some medications your endocrine specialist can give you, such as metformin or other anti-diabetic medications. These can be taken even if you do not have diabetes, because basically the mechanism of PCOS is the same as the diabetic conditions. So these medications do help. Thirdly, your gynecologist can give you certain medications such as what we call inositols to help improve the functioning of your ovaries. They also may suggest you oral contraceptive pills, especially a couple of them which have got a component which helps to reduce the abnormal hair growth and acne by antagonizing, that is, fighting against the increased testosterone levels. So this is what your gynecologist can do for you. If you're not keen on going on to hormones, then you need to make sure, as you may remember, that you have to get your period once in 2 to 3 months to avoid those long-term effects of dreaded endometrial cancer. And this can be done by taking a progesterone hormone every say 2 to 3 months if you don't get your period, and inducing a period. If you have concerns about the psychological effects, of course you can see a counselor or a psychiatrist as needed and as advised by your primary doctor. Okay, so it's a lot. There is a lot more to understand in PCOS. Even the medical community is doing a lot of research, and these videos may not stand the scrutiny of time in the future, because more evidence and knowledge may evolve from the research that's going on. But as of today, this is what PCOS is, and please let me know if you have any queries. Thank you.